Hello, good morning, good day, good evening, all participants in today's APTOS webinar. Welcome and thank you for finding the time to join us. Today's title of the webinar is Strategy, Governance and Role of Digital Health in the 21st Century Healthcare Programs. And it is my great pleasure to announce tonight's speaker, which is Ms. Zhao from the World Health Organization. I'll just spend a minute or two to introduce Zhao before I hand the presentation over to her. Yu is a WHO Technical Officer with the Department of Digital Health and Innovation at the WHO headquarters in Geneva. Her work focuses on the implementation of the WHO's Global Strategy on Digital Health 2020 to 2025. Before joining the current team at WHO, she spent 6 years transferring life-saving knowledge during health emergencies and co-created the openwho.org platform, which is WHO's emergency digital learning platform, which currently hosts 5 million frontline responders across the globe. So truly a large-scale program. You earned an MBA in Innovation and Technology Management, a bachelor's degree in communication and an honorary award diploma from École Hôtelière de Lausanne. She loves linguistics and is an advocate of lifelong learning. So thank you very much for joining us today. I will pass it over to you for the presentation. To all participants, if you have questions, please post them into the chat. And once the presentation is over, we will select questions and we'll have a chance for discussion, open discussion following the presentation. So I'll pass it over to Ms. Zhao now.
Thank you very much, Andreas. And it's really my pleasure and honor to be here and present to you. Maybe take a couple of minutes just to present you the positioning of the WHO in terms of global strategy on digital health and what is the plan for WHO in the next upcoming 5 years in regarding how to promote and improve health delivery and health outcome under the universal health coverage and the GPW 13 goals of WHO together with partners and countries. I'm going just to share my screen. Can everyone see my screen?
Yes, we can see. Perfect.
Right, perfect. Okay, great. So actually in WHO, we're saying that it's not only digital health, but it's really health in digital era. There's really growing consensus among all the member states, all the countries, and in the global health community that the strategic and innovative use of digital and cutting edge technologies is becoming an essential enabling factor to help improve health service delivery and improve healthy well-being. And under the current work plan, the 13th General Program of Work of World Health Organization, Dr. Tedros has really lined up the direction and the visions and simply as a triple billion goals, which is 1 billion more people benefit from universal health coverage, 1 billion more people better protected from health emergencies, and 1 billion more people enjoying better health and well-being. So these and digital health has become a very instrumental enabling factor to support achievement of the triple billion goals. Digital transformation can be very disruptive, but technologies such as Internet of Things, virtual care, remote monitoring, artificial intelligence, and big data analytics, and etc., can have really potential and proving increasing evidence to enhance health outcomes. And at the same time, while we're benefiting from the increasing advantage enabled by the digital health, digital transformation, and the cutting-edge digital technologies, there are also downsides. This is particularly critical for countries with less development level and less digital maturity level that are still in need of institutional support for starting from developing a country strategy or e-health strategy, as we said before, 2018, and implementation of such a strategy in upcoming years. They need really much help with resources and capacities as well. So let's say, for example, take artificial intelligence as one of the best example. We're currently having definitely emerging uses for AI for health, such as in the radiological diagnosis, as well as in RNA and DNA sequencing. And for the TB detection currently, AI is not actually also piloted for management or treatment and care for people long living with the tuberculosis as well. But at the same time, there are also countries where there's a very big issue with data management and a very essential, let's say, data, which is essential for artificial intelligence, cannot be properly managed or even stored simply because there's a lack of information health system or electronic patient record. So it is real time for WHO to also take the leadership to look at the global policy level, how we could better harness the cutting edge technology and help countries and different partners to appropriately make use of digital health, digital technologies such as artificial intelligence and any other and different type of technologies. And this is why if coming back to the topic today, when we look at the global governance level, from a very high level global governance level, all of the story started back to 2005 when we have the World Health Assembly, the 58th World Health Assembly. Member states passed a resolution on e-health. And this is really the starting point that we have institutionalized the needs for having a governance on the e-health technology, which is, let's say, the version, an alpha version of the digital health. And this time flew until 2013, when we started to look at the particular issues under the e-health. And here we passed another resolution on the 66th WHA, World Health Assembly, specifically on standardization and interoperability, so to facilitate better information sharing through different systems, either at the subnational or national level or at the global level. And this is not until 2018, so 3 years ago, member states really recognize the emerging need with the use of these emerging technologies that we mentioned before. And they really clearly particularly ask the Director General of World Health Organization to draft, in close consultation with member states, to draft a global strategy on digital health, identifying priority areas that's where WHO should focus its effort. And after the May 2018, numerous consultations has taken place with different countries and the stakeholders at global and regional level. And finally, last November, at the 73rd World Health Assembly, the Global Strategy on Digital Health has finally approved. And currently, a 6-language version, the UN language version, is available online. And I'll be sharing with you the links later in the chat as well. And the vision for this global strategy really passes what has been written under the previous resolution in e-health. It's really looking at, as we said before, to support the improvement of health for everyone, everywhere, by accelerating the development and adoption of appropriate digital health solutions to achieve the health-related SDGs. And they're all together 4 guiding principles. Not only the strategy acknowledge the institutionalization of digital health in the national health system, which really linked to the investment and fundings and initiative taking place in the upcoming years, but also it recognizes successful digital health initiatives requires integrated strategy together with other national strategy. It not only promotes appropriate use of digital health, technological health, but last but not least, very important, it really addressed the major barrier faced by least developed countries, as we mentioned before, according to their different level of maturity when implementing the digital health within the country. The most important thing, I think, the takeaway from today is the 4 strategic objectives under this global strategy document. Respectively, the first one is really focusing on promote global collaborations and knowledge transfer on digital health. So really to harness knowledge, not only on a high level, let's say on a global level, but also on the national level, subnational, or even community level, to really facilitate different stakeholders trying to harness a theoretical but operational evidence throughout the implementation and operation of the digital health interventions. The second one is really focusing on implementation of national digital health strategy. The third one is about strengthening governance for digital health at different levels. And the fourth is really focusing on, I would say, the emerging issues raised by many stakeholders and countries about advocate people-centered health system. So not one direction, but two double direction, let's say healthcare, and given and enable and empower not only patients, but also all the populations to take care of their health situation. So these are the 4 strategic objectives. Let's go through them one by one. The first one, and here before maybe jumping to the details of different SOs, I would like to talk about how this entire strategy is structured. So as you can see here, all the member states, they don't want to just have a simple, let's say, a document sit on the shelf with dust. They really wanted to have something that is actionable immediately after endorsement of the strategy. So if you look at the document after this session, you will find out that actually there's an annex already defining very concrete actions, and altogether there are 172 actions defined by short term, so 1 to 2 years, medium term, 3 to 4 years, and long term, 4 to 5 years, and so on. And particularly for 3 different stakeholders, which is WHO Secretariat, member states, so the countries, as well as partners like you, like the associations, really lie down to very particular actions that have been approved and endorsed by the member states. So this really creates already a very clear framework for action for different stakeholders to, let's say, to select the most important and prioritized particular actions for them to perform and to achieve in the expected time frame. So back to the SO1, here we're really talking about global collaboration, really focusing on building up capacities, networks, and initiating policy dialogues. So for example, taking COVID-19 response, for example, we have seen really increasing use and pilot of different digital technologies, such as let's say the digital proximity tracking, which is really generated a hype last year, this time. But in order to really create acceptance and persuading, let's say, really creating digital trust within the community, we really need a whole of society and a whole of government approach. This is why we really need collaborations, but we also need to generate knowledge so that we don't always starting from zero. And this is the major, let's say, the major goal and the output that we would like to achieve through the strategic objective 1. It's about knowledge transfer and it's about global collaboration. And when coming to SO2, which is the implementation perspective, here we're not only talking about a strategy document, as mentioned before, but we're really talking about how to create this phenomenon so we can facilitate the prioritization process for countries, that's where the numerous different digital technology pilots are definitely taking place. How we could use this chance to help them to prioritize the really needed for them that could particularly address particular health issues in the country, and how to prioritize investment and the future norm and standard products. And to enhance a particular, let's say, policy and co-capacity within the country. That's perhaps enhance of the co-capacity under the international health regulations as well. And which is really very interesting because we're talking about a dynamic health maturity model here, which is is one of the essential tools for us to evaluate the performance and the status of the implementation of the country, as well as the readiness of the digital within the country. And in the recent published one publication from the actual WHO emergency program, where they're talking about the health system strengthening under emergencies, specifically for COVID. For the first time, they also mentioned maturity, this word, in their document. So I'm very happy to see that actually we're really now talking in the same language in non-emergency and emergency status for different health, let's say health domain. We're really looking at by evaluating the maturity level of the country so that we could improve the implementation of either the digital health strategy or other strategies within the health domain. For the SO3 here, we're talking about strengthening governance. Not only about building up a structure, which is also very important simply because many of the countries, they do not have a particular dedicated, let's say, institutions or structure for digital health. Currently, they either sit in ICT, a department or ministry, or sit in a different ministry with a particular role. So this is very important, let's say one of the important milestones for WHO to achieve also in the next 2 to 3 years is to help countries to create this structure for digital governance. But also we're looking at how we can set up also the regulatory framework and policies aiming for particular, let's say, emerging issues for digital health. So make one of the example here is this, we just published this guidance on ethics and the governance of artificial intelligence for health. We're really looking to provide, let's say, preliminary recommendations for diverse stakeholders, for specifically for policymakers, for member states, but also for developers who are really at the front line of the AI adoption and the development. So this is just one of the examples that not only we help countries or help partners to create a governance structure, but also we wanted to work together to develop a particular governance document and normative products to address particular emerging issues such as AI and the data governance as well, which is very critical work for WHO. And we're currently really in the preliminary phase of developing a regulatory framework for data, health data, which is really a very heated topic, of course, recently as well. And the SO4 here, everything is really about minimize and prevent the digital digital divide as well, due to the implementation and the increased usage of digital health. And here is really about equity, really about assure equitable access to digital health technologies and health services and products enabled by digital health. Here we're really trying to understand how we could let's say, approach the end users of the digital health technology by patients or health workers to improve the digital health literacy and prioritize a particular normative products as well. So, in summary, this entire implementation cycle for the strategy and the governance is really a dynamic status. We're currently consulting in the consultation with different member states, different countries and the stakeholders, and trying to, let's say, trying to hear your voice through the activities and events like this one, trying to understand what is the particular needs and what is the emerging challenges also throughout the COVID-19 response, and trying to really create this co-creation initiative and model to help countries and help different stakeholders to achieve the objectives, the full objectives underlined under the strategy document throughout this 5 years time. Here is just a very quick, very, let's say, overview of the 172 actions, as I mentioned before. As you can see, it's really kind of lined up with different stakeholders, and you can see the differences between the short term and the medium term and the long term. Well, to summarize this entire presentation, all the actions and all the actions, it's 172 actions we're aiming to achieve is really to create impact, to create a more sustainable ecosystem under the digital health and a cost-effective health system and services, to accelerate digitalization of the health and well-being sector, and ultimately we can achieve a healthy population and health for all. So also, I will stop here and thank you very much for your listening and participation. I'm happy to answer any questions after the session. Over to you, Andreas.
Yep. Thank you very much. Thank you very much, you, for your very insightful presentation of the certainly comprehensive work WHO is tackling in the space of digital health. A great overview. Can I encourage all participants to ask any questions you might have in the chat now, so that we can pass them on? Otherwise, I might just start off with a question. You know, in terms of digital health innovations, you know, often these innovations are fast changing and they're progressing fast, which is or can be in contrast to how government systems function, which are in reality often slow in adapting change. So you mentioned 172 actions for not only for countries, but also for partners. But in your view, what would be some key changes or quick wins in the approach governments should take to digital health that could fast track the uptake and delivery of these technologies to populations? So in your, I mean, I assume you might have done some prioritization or have some key recommendations. Which approaches do you think governments might or should take on to improve the flexibility and uptake of these novel technologies?
Should I answer the question now, or?
Yeah, I haven't got any additional questions, so perhaps yes, that'd be good.
Yeah, thank you very much, Andreas, for the question. This is a very good question. I think, so let's say, I think this is not new because there's always any, because I would say innovation, digital is really one part of innovation. Innovation always exists. So there's always a disruptive, you know, whenever technology comes up. We have vaccine, we have different other technologies. So I would say digital health is really one part of it. So, let's say there's always a cycle. We always have early adopters. We always have this, you know, enormous mainstream scale up scale up period for adoption of the technology, then we have, the final of the entire cycle. So I would say this is also why we always, we're always saying it's not really about digital health. It's really about health in a digital era. And, today we're talking about digital health. In 10 years, we'll only talk about, digital health as health. So in a way, there's, it's the same, I would say it's the same for the governance, and it's the same, our attitude is the same. It's always to support the member states to trying to capture the evidence, throughout this entire way. And back to the digital health strategy, as you can see, we started with 2005. And that's like almost, always 20 years ago, where we have the e-health as a starting point, where everyone was talking about electronic health records. We're talking about ICT, and this has been really tremendous, important for building up the infrastructure and the health system as really the backbone of the entire digital health that we talk about today. Because without all of these, we can do nothing about it. So I would say country has done definitely tremendously for each of the country to already create infrastructure, to create the base on which that we could harness a lot of knowledge today. And it's just really now, with a very cutting edge and emerging need, we're not transferring from e-health to digital health. And if I may point it out, that there are already more than 120 countries that already has an e-health strategy even before 2018. So this means that there's already a lot of countries that have done tremendously already in, let's say, in the domain of digital health or e-health, if we may say. What is really need to be done is a smooth transition. Let's say we're harnessing, and we really need to collect lessons learned from the 2005 and 2018, this period, what has been learned throughout the e-health era, and how we can really better prepared and even using a very integrated way to step into the digital phase of today. So we can let's say, embracing the cutting edge technologies such as artificial intelligence, how to integrate all of these technologies into the current situation. And then meanwhile, coping with the, let's say, the emerging infectious disease hazards as well. So there's a different way to look at it. But I just wanted to say that I think the approach remains the same. But what we are doing is really to support countries, trying to make a smooth transition, trying to see what they have learned and have done through the e-health, and how they can do better. And according to their digital readiness level, let's say the maturity level of digital as well.
Great. Thank you. I do like the term health in the digital era. I think that's a great slogan. We have got a question in the chat here from Juan Maria Pablo. Ethics, as we know it, has cultural and social aspects. Do you see this in the ethics for AI? So the question is about cultural and social aspects for AI. Yes or no? Or what might they be?
Thank you very much for the question. I think it's a really good question. So first of all, I'm not an expert in ethics. That's just so I don't want to overstep also into the total, let's say, the knowledge of that's the ethics technical officer from our organization. But absolutely, I mean, ethics is let's say just take example of the document I was introducing, the ethics and the governance of artificial intelligence for health. This guidance we just published. Here we underlines already, let's say, the key ethic challenges, and in which there are definitely bias and discriminations associated with AI, and there's also let's say, challenges, accountabilities and responsibilities for use of AI, as well as, autonomous decision making. I think all of these are related to the data, the information that the AI consumed during the decision making process, and as which the entire documents also are lined up. The consensus principles here, I will just read out, but I'm happy to share the link of this document. And I think it's really a timely document for us to look at, is that this document says that there are 6 principles that we always need to, it's recommended for us to bear in mind, is to protect autonomy and to promote human well-being, human safety, and the public interest, and to ensure transparency, explainability, and intellectuality, and to foster responsibility and accountability. And the 5th is ensure inclusiveness and equity, and to promote AI that is responsive and sustainable. So I think these 6 principles is really kind of is a guiding principle to cover, to really summarize, I think, the potential risks and challenges that are currently facing. And I think the social and the cultural aspects definitely one of the aspects that we definitely need to take into consideration when talking about ethics and AI.
Okay, thank you very much. A question that just came in: what is the process for WHO to generate the guideline document for digital health? For example, the guideline for ethics and government of AI in health. So just on the process, how does WHO go about this?
Thank you very much, Professor Ming, for this excellent question. So basically, usually for WHO generated guidelines, you will need to have, because there's a difference, I want to clarify first, is that you will have, WHO will have the guidelines, and then you will have the guidance. So this document is a guidance. So it's, let's say, in terms of knowledge generation level, it's a slightly, let's say the highest level is the guideline. So in order to produce a guideline document, usually it's basically over the WHO Guideline Development Committee will oversee the process. And usually you will have a steering committee, just about governance. You will have a steering committee, you will have an expert committee, and then you will have another committee to oversee it. This entire one, usually they will launch a call for experts. You will always see this call for expert expression to be the expert to sit on one of the committees. And you go through a very strict due diligence process and all of these review process as well. And usually these experts, before COVID, they will meet face to face and then they will discuss. This usually takes, depends, but it usually takes years, maybe 1 to 2 years time before having a draft. And then you will go through, sometimes you go through consultation as well. But then for this guidance, this really, I think it started in 2019, and it's really also a panel, it's an expert group, consists of over 20 or 30 nationalities. So it's really kind of diverse group from different countries, but also from multidisciplinary, not only ethics expert, they're also developers. There are different type of people, stakeholders. So this is also why this entire document was designed, not only for one stakeholder, which is usually the member states, but also is for developers as well as for the policymakers. And if I don't remember wrongly, there's also a checklist as an annex at the end of the document. Really, it's kind of practice guidance for these 3 stakeholders. When they wanted to have a particular action on ethics review or particular, let's say, project, they will be able to use that checklist to make a decision. So, we're trying to, let's say, WHO is very good at developing guidelines that sit there and without usage, and we're really realizing this, and we're trying to really create spin-off and different company documents or different initiatives to really transform these meta-knowledge into actionable information. And this is why one of the platform, the OpenWTO platform that I used to work on, is also one example that we really want to push out the knowledge into the front line. I hope this answers your question.
I think it does. Great, thank you. I've got another question by a attendee. I understand the person works in the imaging management space, and the question is, how does one involved in an imaging management corporation discover more about involvement in the WHO projects and documents? So I think the question is, how can you access more information about the ongoing work of WHO's digital health work from the for-profit era, or potentially even collaborate with WHO, etc.? Where could you get information from?
So I'm happy to share with you I'm happy to share with you, one is the general website of the digital health department, where usually the up-to-date initiatives, the ongoing initiatives and key documents and normative products are published. And also, I'm happy to provide you a general mailbox with the group. So in case you have particular questions or proposals, feel free to communicate through this email address. But in general, the engagement, let's say the engagement with WHO, there are different types of engagement with WHO. One is definitely through, let's say, through the official engagement, that is through the government. So it's a governance, let's say the authority, usually it's the authority Ministry of Health or relevant Ministry of Health. So this is kind of the official one. And then you will have definitely a few, let's say, I would say non-state actors. So these are all through the non-state actor engagement. So we have a particular procedure and a particular unit dedicated to review that. And so this is one of the, let's say, the most common and used way of engagement. And another one, let's say, indirect engagement is through WHO collaborating centers. And this is actually a very common practice, especially in WHO country office and at the national level. So for example, in the West Pacific region, we have a different, very closely working with one collaborative center in Australia, but also one collaborative center in China for AI. And the one in Australia is really for maturity model measuring. They're helping with developing particular framework to help the Pacific Island countries to implement their digital health strategy. So this is one of the way, I think the most practical way maybe to engage is to maybe reach out to these collaborating centers and to see whether there's an opportunity to engage. Because many of them have a particular mandate with WHO. Some of them have particular disease focus. So I think maybe that's also one of the way to go forward and to explore as well.
Great, very, very, very good. We've just got another question. Is there strict guideline and regulations for AI application in specific diseases screening by WHO?
Yeah, thank you very much, Professor Raba, for this excellent question. So this is really a timely question, and I must say it's really in the making process. As to my knowledge, we're currently in the review process of should be let's say a guidance for screening of cervical cancer. So this is one of the normative product that I would say is expected to come out either this year or next year. Definitely there are other products in the pipeline, and currently at least for now, I'm not so aware of, but I would definitely keep you updated if there are any, let's say, updates on this type of products. But I'm definitely sure there will be particular disease-specific products together with the specific projects. Because usually if for digital health department, we sit under the science division, which means we are enabling function, we're a cross-cutting unit. So many of the projects, it also is a collaboration with a particular health program. So if there is a particular need from a health program, we will need to have a joint product and to line up the planning. So usually this is a joint effort. And it's not only from a digital health oriented, because at the end of the day, we need to measure the health outcome. So it's always together with the health program. But to my knowledge, we're currently closely working with non-communicable disease, but also work with a few infectious communicable disease departments as well. But I will keep you, let's say, I'll take these notes and come back to you and with updates in case I hear anything particular.
Okay. If there are there any other questions from panelists or participants, attendees? If not, then I would again thank very much our speaker for today, Ms. Zhao from WHO headquarters. Very informative, very interesting, and we got a comment or a question for more links to materials. We will most likely post links and to our APTOS website. So everybody can access further information after the seminar. And for now, yeah, so thank you very much to our speaker, and thank you very much for all our attendees for joining the July webinar.